Bariatrics is a branch of surgery and gastroenterology that deals with the treatment of obesity. Today we will tell you about endoscopic gastroplasty. It is one of the most modern treatments of obesity. This is Rhythms of Health, Peter Pileski. I would like to welcome you from the beautiful operating theatre from the Bariatric Clinic in Jelenia Góra. Obesity is a chronic disease that is a serious health and social problem. The main reasons for its prevalence are changes in modern lifestyles, lack of exercise and improper eating habits. Unfortunately, sometimes even very restrictive diets may not be enough, and increased physical activity impossible. This is especially true when obesity is caused by diseases, especially those with a genetic basis. For many people, the only chance to successfully combat obesity is bariatric surgery. Ms. Joanna has been struggling with her obesity since childhood.
There have always been some comments in terms of my weight or my appearance. Not just from my peers and people I knew, but sometimes somewhere on the street. And this went on for a while, through middle school, high school. When I got out of high school, I found that before college I would take charge of myself and try to lose a little bit of weight on my own. But it was always like these diets had minimal effects, so to speak, or I just kept coming back with this yo-yo effect. I also went to a nutritionist. It turned out at the beginning that I had insulin resistance, hormone problems, and everything was kind of a result of that weight. I was really giving up. I decided that I would probably never lose weight on my own, that it would be like some kind of torture, what I was going through. I was already having really weird thoughts in my head that maybe I'm doing something wrong, maybe I should be starving myself or something. But I've always had my parents somewhere telling me, starving myself won't lead to anything, and you have to do something else here. My mother actually gave me the idea of having maybe bariatric surgery, and that it would be a chance for me to finally have my confidence jumped up a lot too, so that I would stop being embarrassed every time I went to the pool, because I love swimming. I swam for 13 years in a swimming club. And I always had it in back of my mind that, well, I'm not a model to go out in a swimsuit to the pool. But, I analyzed both physically and how my psyche would work afterwards. I have concluded, to the brave the world belongs, and this may be the only chance for me. I'm expecting to lose weight for sure, well, that's kind of the main goal of it all. And what follows is an improvement in my quality of life. Quality of life will also improve, because it's not only a physical pattern, but it's all in the head too, and every kilogram is what we experience, and physically, how our body changes, that's what also affects mental state. The fact that I lose a lot of weight will also translate into how I feel in my head. I'm just saying, the ranks of diseases, glucose, just sugar, insulin resistance, that will also go away when the pounds go away. Confidence will come, and one by one everything will go well in my head, and that will also affect the quality and happiness in life.
You are watching Rhythms of Health, a medical magazine on Polish television, and today we are in Jelenia Góra, in the Bariatric Clinic, and with me is gastroenterologist, surgeon, Dr. Artur Rytmy, MD. Doctor, obesity, what kind of consequences and havoc does it cause in our body? Obesity is an ever-increasing health problem for us, because it is associated with various complications. Above all, what we need to be most aware of is reduced life expectancy. This reduction in life expectancy is due to the fact that patients are more crushed, they very often have hypertension, they often have diabetes, and the coincidence of all these things means that we later have dealing with heart attacks. Doctor, you were involved in gastroplasty. What is this method based on? What is it? For several years now, we have had a new method for treating obesity, to assist in the treatment of obesity, because let us always remember that the most important thing in the treatment of obesity is diet. And that cannot be replaced by anything. All the treatments we do are done to help that patient lose those kilos and change their eating habits. Endoscopic sleeve gastroplasty is a relatively new method. It has been available in Poland for years. The procedure involves placing sutures in the stomach using an endoscopic technique. It is not strictly a surgical procedure. We do not break the continuity of the shell. We do everything with a special kit that we mount on the tip of the gastroscope. What is the qualification process for such a procedure? The qualification for such a procedure is analogous to that for open or laparoscopic surgery. The qualification is identical. The patient must, of course, have a dietary consultation, must have a psychological consultation, a gastroscopy performed, as well as other examinations, and on this basis we then finally qualify him for such a procedure. In order to take advantage of the opportunity offered by bariatric surgery, the necessary diagnostic tests must be carried out. Procedures to qualify a patient for the procedure include tests to assess respiratory and cardiovascular fitness. In addition, hormone tests are performed to ensure that obesity is not caused by disorders such as hypothyroidism. The key test to qualify patients for surgery is a gastroscope examination. The qualification for the procedure is decided by a medical consilium consisting of specialists in several medical fields: anesthesiology, cardiology, gastroenterology. The assistance of a psychologist and dietitian is also necessary. The final decision to carry out the procedure is made by a bariatric surgeon. Specially for the viewers of Rhythms of Health, Dr. Artur Rytmy agreed to comment during the surgery to comment on its key stages. Today we will be performing an endoscopic gastric volume reduction procedure. The procedure is performed using a completely minimally invasive method, under endoscopy guidance. The procedure is performed under general anesthesia. In the first stage, we perform a classic gastroscopy to see if, from qualification to today, there has been some kind of adventure in this stomach that would make it impossible for us to perform this procedure. But also in order to remove any residual fluid that might have been present and which would have disturbed us. We then have to fit the entire setup on this endoscope, which is used for this. In the first stage, we have to set up such a guiding, therapeutic overtube, so as not to damage the esophagus during the procedure.
Żeby podczas wykonywania zabiegu nie uszkodzić przełyku.
The whole idea is the tip that performs the whole procedure of suturing this stomach. The procedure of endoscopic sleeve gastroplasty, as this is the full name of this procedure, is carried out with the help of a gastroscope and a special device with which the surgeon makes 4 to 6 sutures, thus reducing the volume of the stomach by approximately 70%. We completed the suturing of the stomach, and from this originally wide lumen, we now have such a tunnel the width of an endoscope, that is about 2 centimeters here. The endoscopic sleeve gastroplasty procedure does not require the removal of the stomach or the incision of the abdominal wall. Consequently, it is safer than classic bariatric surgery. Possible complications after the procedure include bleeding from the suture line and inflammatory infiltration of the gastric region. These complications occur in less than 1% of all procedures performed. Doctor, you probably need rehabilitation after such endoscopic sleeve plasty. What does it look like? The procedure is minimally invasive, so rehabilitation here is much simpler than after surgery. Patients return to normal function very quickly. It usually takes them about 1 or 2 days. Practically on the 3rd day, you can return to work with confidence and start proper nutritional treatment. And this is certainly what all viewers are waiting for. When do they start to lose kilos? These kilos are lost most during the first year, and it is my experience that this is a significant weight loss. Of course, it is always a problem afterwards to maintain this, as with any bariatric method. Obesity, unfortunately, is not a surgical disease, so it cannot be cut out, sewn up, stitched up and so on. What is needed is the efforts of both the person suffering from obesity and those around them to support them. Let's remember that food is pleasure, so pleasure is very hard to give up. And this is probably the main problem. There is also a problem of a bit psychological for people who do not succeed in spite of bariatric treatment. Whether surgical or endoscopic, they do not seek help, they often shut themselves away, they are afraid to admit that they have not succeeded. Doctor, what are the bariatric methods to help with morbid obesity? Of the surgical and endoscopic methods, we primarily use sleeve gastrectomy and the so-called gastric bypass. And now this new method, the endoscopic sleeve gastroplasty, which is so on the border between surgery and endoscopy. It is more of a surgical endoscopic treatment, and it is the method of all the surgical ones, the least invasive. Which method suits which patient? In general, all surgical methods and this endoscopic method, our sleeve gastroplasty, are designed for obese patients. That is, with a BMI above 30. But it is also important to remember that we often see this patient gaining. And even though he has this BMI already above 25, he is quite overweight, but he is not coping. He's not coping despite dietary attempts, despite various other things. Hypertension is coming on, all these other complications are coming on. So we can also use endoscopic sleeve gastroplasty in such patients, because it is a reversible method, it is a minimally invasive method, and it may be able to stop this weight gain. The question of whether we should already be concerned about our excess weight can be answered by the so-called BMI index. To check it, all you need to do is look for a BMI calculator on the internet and enter your age, gender, height and weight. The BMI 30 index sets the boundaries between overweight and obesity. For those who have crossed this line and their BMI has risen to 40, obesity represents an immediate threat to health and life. Bariatric surgery makes it possible to remove this threat. However, let us remember that the most important fight against obesity happens in our psyche. Today with me is Katarzyna Wolbowicz, MSc, psychologist. And a psychologist because, ladies and gentlemen, in bariatrics, qualification for surgery also depends on psychological support. Why?
When it comes to bariatric patients, it is mainly to support them. For them, this is a very big step. Patients very often wait years for this operation. It is something that is quite a strong and quite a powerful experience. The first step in their so-called new life. For me, as a psychologist, it is also very important not to tell the patient that they now have to stop everything. Because the patient will break down, and it's about that very patient, to show him these possibilities, that it's not that life ends for him. Only he has the possibility to change this life for the better. I am also against the idea of saying not to do such operations for visual reasons only. This is because this visuality is very important in today's world and for the patient, for all of us. And it also guarantees that we have this mental health. If we feel bad in our body, if we think we're unattractive, ugly, too fat, that we're in general,
then we feel unhappy, don't we?
Yes, we are unhappy, we lose our self-confidence, we shut ourselves away, we don't go out to people, professional life, social, family life is declining, but actually these health aspects prevail.
So the operation took place, the patient actually has to change his habits at the moment. He has a reduced stomach, he can no longer eat as much as before. In some cases, of course, this stomach can shrink back, right? How do we motivate the patient so that this doesn't happen?
This is already a very individual job. Food is very often such a reward for us. Food causes us to release in us chemical compounds that relax us, that make us feel safe, that make us feel confident. And that's why very often in situations where we have problems in life, we just eat those problems, yes. It's been said that food is such it hugs us so internally. Like especially if we don't have someone to give us support from the outside, we often eat in order to give ourselves an internal hug. And it's a bit of a trap. Also, you have to look at the mechanisms of why this patient had, let's say, bad eating habits and simply work with such a patient individually. It is not the case that there will be one and the same solution for everyone. Surely such an education is what a psychologist should do. This is what a psychologist does with such a par.
Thank you very much. Looking at Agatha, it's hard to believe that not so long ago she weighed over 100 kilograms and her BMI was 36. It's been over a year since Agatha has decided to undergo bariatric surgery and now enjoys her new weight, a new, weight-free life.
When you were getting fatter, you suddenly had the feeling of taking up more space. Suddenly bumping into furniture, which didn't happen at all before. Walking into the kitchen, cooking a thistle once, a second, a third time, and one begins to wonder what's going on. Or a silly thing like clipping your nails. The health problems started. I was already at literally the last stop before diabetes and I found that I couldn't manage on my own, that I needed help, and so I decided to have surgery. And it was a very good decision, the best decision of my life. I remember that first moment when I see the tram coming and if I walk normally, I'm not going to make it. So I decided, okay, I'll run, I'll be out of breath, I'll be panting for 15 minutes on this tram, but I'll make it. I ran, got on the tram, and it was such a nice feeling that suddenly one is able to function normally again, and that's beautiful. It's not that the treatment did everything by itself, because I also have to work on it. I have to control myself further, but I have the strength to do it. I have the motivation. I believe that I can do it, and on the whole I don't think there's anything I can't achieve.
Bariatric surgery is the operation of last resort for people for whom all diets have failed. They are life-saving operations because they are the only salvation for people suffering from diabetes, coronary heart disease, cardiovascular disease and joint disease. However, it is important to remember that the fight against obesity happens primarily in the head. Bariatrics offers a great opportunity for patients, but how they use it depends primarily on themselves. Today we showed you what endoscopic gastroplasty looks like. This was Rhythms of Health, Polish television's medical magazine. Peter Paraj Pileski. See you next week.